I don't say no for lots of reasons. The most common is patients that are just not, they don't have enough weight on them. Their BMI is not 40. Like they have no issues and maybe their BMI is 37. I physically could do the surgery, but nobody's going to pay for it. There are some patients that are just too sick. There are some patients that are mentally just not in a right place to have the surgery. So you really shouldn't have any uncontrolled mental health or behavioral health issues because it can become a problem down the road.
I'm not afraid to write a brand new story. And when changes find their way to me, I can keep it moving. I'm not afraid to celebrate my glory. And when challenges grace my path, I know I can face another day. Inside, I rise, daring to learn. With Fox After 40.
What's up, you guys? Welcome back to Fox After 40, where we focus on all things women's wellness. And today we're talking about bariatric surgery after 40. And I'm super excited because I have Dr. K here, who's an expert and a surgeon, and she's here to answer all your questions about the process. But before we get into that, I want to make sure I read her bio. All right, so let's get into it. Dr. Karleena Tuggle-McDaniel is a board-certified bariatric surgeon, health expert, and self-love advocate dedicated to empowering the Black community through health and education. A graduate of UMBC and Howard University College of Medicine, she now serves as medical director of a bariatric surgery program in Atlanta. With 15 plus years of firsthand experience addressing health disparities, Dr. Karleena, or Dr. K, co-founded Pro Black Health with her husband to combat vitamin deficiencies and reinvest in Black wellness, donating up to 50% of net profits to health-focused nonprofits. A lieutenant colonel in the U.S. Army Reserves and two-time tour veteran. Three.
I got to update it.
Wow. She balances military service, medicine, and motherhood while speaking nationally on obesity, self-worth, and community health, including appearances at Essence Fest. Now I see why this bio is so long, girl. I didn't know you were in the military. Wow.
I am. But I didn't know I was a mother, so I don't know who added that in.
I'm so sorry. Do I need to read this whole bio?
No, it's fine.
I'm so sorry. I'm sorry. I was reading it like, who did? My team. They
I was like,
my bad.
am I a mother?
You know, I'm sure you've helped lots of moms and, you know, and all the things. So thank you. And I apologize for that.
No,
truly.
it's all good.
So I just gave you a background, but I need the story. You were in the Army? When?
I'm still in the Army.
Wow.
So I'm in the Army Reserves. I joined, or I got commissioned between med school and residency. So I still do my weekends a month, 2 weeks out of the year for like summer training, and balance the rest of my life kind of around that.
Have you ever had to like be a doctor in like war?
That's what they hired me to do. So when I deploy, so I went to Afghanistan once.
Okay.
As a trauma surgeon, which thank God there wasn't that much trauma happening.
Okay, good.
The last 2 times was in Kuwait, and it was like a little military hospital in a non-combat zone, which is more my speed. But yeah, that's technically my job in the military is to be a surgeon.
Were you like a general surgeon?
I train general, and I'm general in the military. That's my classification. But in my civilian life, I do bariatrics.
Wow. Okay. Girl, we're going to get into bariatric surgery. I promise.
No, take your time.
But if you're in general surgery, in my mind, so I watched a lot of Grey's. Okay. I watched 20 seasons of Grey's. Okay.
Me too.
Oh, did you?
Mm-hmm. I'm still watching it.
Most doctors don't watch shows like that.
I've been a Grey's fan since
it
started.
Come on. And I got a bracelet like that too, girl. Anyway, okay.
So some of it is like tomfoolery, but I'm just like a day oneer, and I just got to see what the hell Meredith is going to do. Blown up shot. I'm like, come on.
So the reason I even brought up Grey's is because to me, when you say general surgeon, I thought in my mind, that's like elite. That's like the highest level of doctoral surgery,
I wish. General surgeons are actually like bottom tier.
What do you mean? You're good at, you have to do general surgery.
Right. So you train in a little bit of everything, but the way that medical training has changed, most people will do some kind of fellowship or specialty training. So I did a fellowship in bariatric surgery. There are very few like true general surgeons that like come out of training anymore. But in theory, we should do a little bit of everything, but you have vascular surgery, orthopedics, there's breast surgeons, endocrinology surgeons, cancer surgeons, plastic surgeons. I mean, the list goes on, but yeah, general surgeons are like, meh, you're general.
Oh, wow.
And I'm fine with that.
And so you grew up in New York, and then you went to college, Howard Medicine.
I went to Maryland, University of Maryland. Then I went to Howard for med school and residency.
Okay, gotcha.
And then I came here in 2010 for fellowship, and I never left.
Gotcha. And then you joined the military later.
I joined the military when I was still at Howard.
Okay. Cool.
2005.
Gotcha. I love this. Thank you for sharing all of your background. All right, so now we can get into, well, why did you choose bariatric surgery?
Oh, I love that question. To be completely honest, I was in I got into surgery as like a last resort because I hated everything else. And I thought I would be a psychiatrist when I started medical school. And then I did a psych rotation and I was like, I'm not that kind of crazy. Like you have to be a special kind of person. And it's needed because I have a psychiatrist, but it's not something I could see myself doing. I like to keep busy and do stuff. And OB-GYN was my second to last rotation. I was like, okay, I like this. I like cutting and guts and stuff, but the baby stuff, I was like, ain't no way. So then surgery was last, and I was like, well, I guess I got to pick this. And then when I was in my residency, general surgery is a lot of ER work. And I have a lot of anxiety, and just waiting for any and everything to come in is just like, why would I want to do that to myself? And bariatrics is, for the most part, pretty predictable. But what I really liked about it is it's almost like giving people a second birthday. If they do what they need to do, it can be life-changing. So cancer surgery can be life-changing, but it's very morbid at the same time. Bariatrics, there's so much hope, and almost like people either get to know themselves again or become people they never knew they could be, in a way that I wish everyone can enjoy their life and be their best selves. So there's like gratification there when I see people like, you could have been doing this, you could have been going wherever you want to go and doing what you want to do. But it's just nice to empower people to be able to like be free.
That's beautiful. That's so heartwarming. Oh my gosh, you're like changing lives. So can you define for the people what is bariatric surgery?
Okay. So bariatric surgery is weight loss surgery, but a lot of people confuse that with plastic surgery, like tummy tucks and all that stuff. Bariatric surgery is, I work on the inside of your abdomen. So I'm cutting your stomach and your intestines. The lap band used to be a really popular thing. So it's more altering your digestive tract so that you absorb less calories, you get full quicker. There's some adjustment of your metabolism, but it really is for you to change your lifestyle. It's a tool, right? And if you use that tool properly, you can keep the weight off. But the biggest thing about bariatric surgery is all of the illnesses that you can prevent or resolve. The high blood pressure, the diabetes, the sleep apnea, the high cholesterol. So it's not cosmetic. Weight loss is an awesome side effect, but getting off of your medications and just being healthier is really what bariatric surgery is for.
Okay. Can you explain to me the surgery itself? Okay.
So the main two surgeries that are done now are the sleeve and the gastric bypass. So the sleeve is literally, I cut the stomach until it looks like a banana. It's called a sleeve because I guess it's long.
How does it look before that?
Like a football.
Okay.
So I take out 2/3 to 3/4 or so of the stomach. You'll never see it again. There is no rerouting or changing the rest of your intestines or digestive tract. So how you digest and absorb before surgery is the same way you would after. I just give you a smaller bowl to hold food in at any one given time.
Okay.
Versus the bypass, I cut the stomach to about the size of like a plum or, about a plum. And then nothing is taken out of your body. But in order to be like, your mouth is connected to your anus, right? Mm-hmm. Theoretically. Well, no, in real life, that's what it is. But in order to get your stomach back into the pathway, we have to cut the intestine so everything stays connected. But nothing is taken out. So it's hard to explain unless like I drew it. But technically, a bypass is reversible. A sleeve is not. Okay. But a bypass is a stronger procedure because it does two things versus one. You eat less and you absorb less after a gastric bypass. With a sleeve, you eat less, but you absorb the same. So, and there's all types of things people do to cheat the system. And like, why am I not losing weight? Because you can't eat a lot at one time, but you can nibble all day. You can drink all the calories that you want. And people kind of fall into these kind of bad habits.
With the sleeve?
With both of them.
Okay.
I've seen weight regain on both of them. More with the sleeve.
Okay.
So the bypass estimated about up to 65% of your excess weight. A sleeve is about 50 to 55% of your excess weight. Again, that's if that person is doing their part.
If you've enjoyed this episode of Fox After 40 and want to get notified about the next episode when it drops, make sure to go to CurlMix.com and sign up for our mailing list. We'll notify you whenever a new episode comes out. And what size of, I'm trying to figure out how to know if that's something I would consider, right? So like what are your patient sizes typically? So
it goes by BMI. That's kind of like the benchmark that insurance companies use. Okay. So BMI is like a calculation that puts together your height and your weight. And you can go on Google, put in BMI calculator. But it spits out a number, right? So healthy weight is 20 to 25. Overweight is 25 to 30. Okay. Obesity starts at 30, so 30, 35. But you're not morbidly obese until you're 35 or higher. Okay. So if you were to go through insurance companies will not even consider it until your BMI is at least 35. But between 35 and 40, you have to have 1 to 2 illnesses related to obesity. High blood pressure, diabetes, cholesterol, sleep apnea. If your BMI is 40 or higher, you don't have to have any other issues. So that's kind of the measuring stick, if you will, in terms of are you a candidate or not.
Are there any people that you turn away for the surgery?
For any reason or size or?
Well, I don't. So you just say no for lots of reasons.
Well, I don't say no for lots of reasons. The most common is patients that are just not. They don't have enough weight on them. Their BMI is not 40. Like they have no issues and maybe their BMI is 37. I physically could do the surgery, but nobody's going to pay for it. There are some patients that are just too sick. There are some patients that are mentally just not in a right place to have the surgery. So you really shouldn't have any uncontrolled mental health or behavioral health issues because it can become a problem down the road.
You know, why I want to pause on that. I was looking at the surgery maybe like a couple years ago. And I was like really considering getting it. The only thing that made me change my mind was the gut bacteria. They said that your gut bacteria changes afterwards. And so some people reported like a lot of depression. Is that something that happens or like, and I don't know if that's true. I mean, I was on YouTube, you know, so you're a real doctor, so you can speak to it.
So that's a very like loaded statement between the gut bacteria and the depression because both can be true. Okay. And they may be related, but they may not. Because I will say that I would say 2/3 of my patients before surgery have some type of anxiety, depression, PTSD, something. Yeah. Because that leads to destructive eating patterns in general. In terms of the altered gut microbiome and all that, it changes to some degree, But for most people, if they take a probiotic and they kind of watch what they eat, it can be managed. But you are right that gut health is related to mental health, but I wouldn't say it's because you had the surgery that it changed to the point where now, we're squirrely upstairs. And you were squirrely before.
Right, and I didn't even think about that. It's like, well, Kim, if you're like 7 wait, you probably, oh, that makes a lot. Okay, I get it. I didn't even think about that.
I didn't want to be a shrink, but I'm a shrink to a lot of patients.
I feel that.
Yeah.
I very much feel that. Okay, so I also looked it up, right? Mm-hmm. There's a lot of stuff you have to do before you can actually get bariatric surgery, correct?
If you go through insurance, yes.
It's like a juice diet for like 2 weeks or something?
I don't do the juice diet. It depends on the practice, but I do put you on a 2-week diet. The first week is 2 protein shakes. Like, let's say you do one for breakfast and one for lunch, and then you have like a high protein meal. And then the week before surgery is just all shakes. And then in between, it's like nuts or, some kind of little protein snack. But there are like full liquid diets that some patients are put on, but it depends on your size. So let's say you're 500 plus pounds, you will probably have to lose a lot more weight prior to surgery to make it safe and or feasible. So that person may be put on a restricted diet for a month or longer. It really just depends on the situation.
Is there like a maximum? Like you can't be over X amount of pounds to get the surgery?
Theoretically, no. I don't do patients whose BMI is more than 60.
Okay.
Just because I do it laparoscopically, and more than 60, it just makes it very challenging to do. So I have a lot of friends who do robotic bariatrics. More than 60 is very feasible if you do it robotically. So there really is no top weight. But for the...
Can you explain the laparoscopic surgery?
Mm-hmm. So laparoscopic surgery is, I put air in your belly and it blows up. It looks like you're pregnant, but I can see all the organs, and I use instruments that are like long and skinny, that have like different features, right? Some scissors, some clamps, all the staplers, what have you.
How is the instrument put in the body?
With like a little tube. It's called a trocar.
Does it go through your throat?
Mm-mm. It goes through your abdomen. Okay. So I make 5 little cuts.
Okay.
About a centimeter. One goes for the camera, then I have 2 hands, and my assistant has a hand in, and then one holds up the liver. So the recovery is much easier than open surgery than back in the day when they would like make a big cut, which is why for a lot of bariatric surgery, you can do it same day at a surgery center and go home. In the hospital, I send most people home by the next day. So the recovery is way better than what it used to be.
Okay. So 5 incisions, the cameras, the tubes. Okay, this sounds great. So you go home, and what does it take to go home? You just have to have like I imagine you're not having a bowel movement, or can you?
You don't have to have a bowel movement.
Okay, gotcha.
Most people don't have enough in their system to even have a bowel movement, but your nausea must be controlled. Your lab work has to look good. Your vitals need to be appropriate, because the main things that I would be concerned about after surgery is if you have a leak, which is like we put all these seams together and now you have an opening. So the stomach and bowel contents are leaking out, and that'll make you septic, right? But that presents like, I can tell when someone is sick. And also a blood clot. So walking, I make them walk before they leave with physical therapy and all that, and really emphasize that going home, they have to walk like every 1 to 2 hours. Okay.
What are some side effects of bariatric surgery?
Besides the weight loss?
Besides the weight loss, girl. I'm sure, I know you get some.
So there's mental side effects and there's physical side effects. On the physical side effects, if we're speaking more to like negative side effects.
Well, also, how much weight are people dropping? Like how quickly too?
So again, it depends on what your starting weight is, right? So someone who's 500 pounds is going to lose more weight in that first year than someone who's 250.
Yeah.
I tell my patients to expect probably between 60 and 80 pounds in the first year.
Okay.
It slows down dramatically after 12 months. So you can continue to lose. It just takes a lot more consistent effort because people get used to it. So you lose weight, you feel in yourself, and then you used to be so strict when you first had it because you felt everything and I want to be good. And then you're like, you know what, I deserve XYZ. And before you know it, it goes from once a month to once a week to every now and then, and you lose track of you reintroducing a lot of these high calorie, low nutritional value foods. So it takes a lot of persistence, especially when you feel normal now and you've lost weight and you're not as stringent on yourself. But so yeah, we said weight loss, muscle mass is something, with any rapid weight loss, muscle mass is a big concern because you want to lose fat quicker than you lose muscle because muscle controls your metabolism to a great extent. The best way to prevent that is to make sure that your protein intake is adequate and also that you're doing muscle resistant exercises. So those who don't exercise at all or who just do cardio, they're going to burn their muscle. And then your metabolism drops, and then it gets even more difficult to continue to lose weight because you don't have as much mass that is actually burning fuel.
Yeah.
So I see that. Constipation is very, very common. Are
you supposed to take something? Is it probiotic or?
Probiotics for some people, but I say Miralax, increasing fiber, because you're not eating a lot of fibrous food. We say fill up on protein first, right? So fiber supplements, Miralax, making sure you get enough water. A lot of them just don't drink it. They're not hydrated. But all of those things that can be managed with just supportive care if they stay on top of it. A lot of bypass patients complain of really bad gas, like smells horrible.
So one of
horrible.
One of my fears that I would have is like, oh my God, like what if I'm just like I'm gonna like die on the table? You know what I mean? Like that would be like that's when my brain goes to when I think of surgery. What would you say to combat that fear? If you've gotten any value from listening to Fox After 40, you learned a beauty tip, you've gotten advice, you shared the episode with a friend, please do us a favor and leave us a review on Spotify and Apple. It goes a very long way in helping us continue to build the podcast. Thank you so much, and I'll see you in the next episode.
Anytime you go to sleep, that is a possibility. But by the grace of God, I've never had anyone die on the table, but that's why there's so many tests that we do before surgery to make sure that your heart is strong enough, your lungs are strong enough, that you don't have any systemic issues. Because if you were to die on the table, it's not because of the surgery, unless something really crazy happened. It's because you had a heart attack, you had a stroke, something organ-wise failed, and you didn't recover. It's not because of the surgery. I would say 99.9% of the time if that were to happen.
Yeah. So you're saying you run all these, that makes sense too. It's just like you gotta have all these qualifications, run all these tests before we
gotta make sure your body is strong enough to like go through the surgery.
To lay on that table.
Yeah.
Yes. Oh, that makes a lot of sense. Okay. Is bariatric surgery affected at all by women going through menopause? Does that change anything?
You mean if they're already in menopause? I wouldn't say it changes anything because your hormones are already kind of out of whack. So let's say you're not menopausal yet. You're in your reproductive age. A lot of women who suffer with obesity also suffer from infertility, PCOS and all that. And losing just a little bit of weight sometimes flips them into being fertile. So I always tell them for the first year to 18 months, use a condom because birth control doesn't work the same. And I've had quite a number of patients who get pregnant within the first 6 months after surgery.
Wow.
And it's not that you can't get pregnant. It's not that something bad's going to happen to the baby, but you're on a time clock, right? So your body's going to get used to the surgery after a certain point. So let's say you get pregnant at 3 months and it's natural for your body to gain weight or to maintain that weight. So now we're 9.5 months later, you don't just go back to your 3-month weight loss because the weight loss is the most extreme or the most rapid in that initial phase. So it's like you interrupt it and you're not where you could have been if you didn't have that pause, so to speak. So I would say that for premenopausal women, it definitely affects the hormones so that you are more fertile. After menopause, it's not quite the same because you've already had these derangements. So your estrogen's probably already lower, progesterone. But what you need to be cognizant of is menopause itself, for all women, you're at a higher risk of bone loss, so osteoporosis, higher risk of cardiac disease, depression. So when you lose weight, you also can lose bone mass. So it's kind of like you're compounding that effect, which is why you need to be aware of at a certain age, you might have to be very, very on top of getting your bone density scan and making sure you're getting enough calcium and vitamin D, because you have age, menopause, and rapid weight loss all working kind of against what the body naturally wants to do.
Have you ever done a surgery twice on the same person?
Yes.
And that's possible. Like, you can do that. It's not like not recommended or.
So it's not a passion of mine.
She's like, no, girl, I don't want to do this.
But I've converted a lot of sleeves to bypasses because either for reflux, sleeves can cause a lot of reflux for a lot of people. And the bypass is the only anti-reflux procedure. So that's one indication also for inadequate weight loss. So a lot of sleeve patients, I said, because it doesn't do as much, they either don't get to their happy place or they regain some to more than their starting weight. So they may need another procedure to kind of start losing weight again. You can revise a bypass, but I only revise bypasses if there's like a technical problem.
Yeah.
Because there's only so much you can keep whittling away. And for most people, if you regain the weight, it's not because the surgery failed. It's because you're not doing your part consistently or life happens, you know? I broke my ankle, so I couldn't exercise for 3 months. Oh, I had a death in the family. Oh, you know, surgery is not going to combat or change whatever life is going to throw at you.
Yeah.
And you have to understand how to maintain the healthy lifestyle principles for the most part, regardless. And it's hard.
Yeah. I mean, look, I know. My last question. What does post-op look like? After you've gotten like the surgery, what are you doing to like take care of yourself after?
So you go home, then we stage the diet so that every week you're kind of advancing to like a heavier consistency. So for the first week it's clear liquids, and then second week you're on like protein shakes and like pudding consistency type things. Third week is puree, and then fourth week is soft diet. So about 6 to 8 weeks, most people are on regular consistency food. That doesn't mean that everyone tolerates it the same. A lot of people say that certain meats like just sit heavy or won't go down, but maybe they're not chewing it enough. Maybe
Can they
it's
feel
not
it?
moist.
They
feel like it gets stuck. They say it feels like it gets stuck right here.
Oh, that's uncomfortable.
Yes. Yes. And some people ignore that and still eat and end up in the emergency room. Some people get food phobic, and because they feel like nothing works, which is another, kind of situation that you have to deal with. But
so they're afraid to eat.
Yeah.
Oh, okay.
Yeah. Those patients make me sad.
Yeah.
Because it's like, we did all this, you're doing with your weight loss, but everything you eat makes your stomach hurt. So how do we, that's not where I do it to get you in a better place.
Yeah.
And it just makes me sad when there's something that is like, oh, I wish I never did this, or I'm unhappy, or whatever the case is.
What percentage of people do you feel like that actually ends up being? People who will regret the surgery?
Low. I would say less than 5%.
How many surgeries would you say you've done?
Probably between 900 and 1,000.
Oh, wow. And you said less than 50 actually regret it.
That have told me.
Okay.
So a lot of patients, you talk about aftercare, right? So in the first year, I'll see you at a month, 3 months, 6 months, and then a year. And after that, you should be seen at least once a year to check your vitamin levels and, make sure your weight loss is on track. But a lot of people, once they hit that 2 year mark, I never see them again. Whether because they're comfortable, or a lot of them regain weight and they feel shame, or they feel like if they come back, I'm not gonna chastise you. I understand it's a process, but I think a lot of it is embarrassment. So I couldn't tell you what the real number is, because a lot of patients just kind of fall off the map after about 2 years.
Gotcha. Wow. This has been extremely educational and helpful. I feel like I definitely had some misconceptions about bariatric surgery before that now you've cleared up for me.
Oh, yeah, it's fine.
So I'm not as afraid of it as I once was.
No, there's nothing to be afraid of.
Thank you for sharing. Yeah. Is there? And you brought me a special gift.
I brought you a gift. Yes, I did.
Yes. So you are the co-founder of Pro Black Health.
Yes.
And can you tell me about Pro Black Health? Oh, and you guys, she gave me a nice box. I'm going to unbox for you guys and show you what's in here.
So Pro Black Health is a vitamin company that Darian, my husband, and I started about 7 years ago. And it was really based off of the fact that I do check so many vitamin levels, and 92% of African Americans are vitamin deficient, and with vitamin D and iron being the most common. And I see so many patients who use the emergency room like a primary care office. And I see so many young people, 20s, 30s, with old people diseases, like really bad diabetes, really bad high blood pressure. You had a stroke at 35, just crazy stuff.
Yeah.
And we were trying to figure out what is something that we can do to increase health awareness and consciousness and really shift more towards preventative things versus reactive.
Yeah.
And we were like, okay, well, vitamins is a good way to start that conversation. So vitamins are not the be end all, but it's a good way to start the conversation about your health. And then we introduce other things. So eating habits and sleep patterns and exercise and mental health to be like a comprehensive, healthy person.
Yeah.
But sometimes you need something tangible. And then we also wanted to make it so that it resonated with the Black community. So there was no vitamin company that specifically targeted us. And, us, like, why don't you take your vitamins? I don't like pills. I don't like how they smell. I don't like how they taste.
Yeah.
So we do have tablets and capsules, but we have a lot of gummies because we're trying to make health fun and frictionless. Like, how do we take away some of these obstacles?
Yes.
So,
and you mentioned vitamin D deficiencies, and I think it's important because for women going through menopause, I know that's one of the things that a lot of the doctors check for your hormones.
Yeah.
Because it helps regulate all your hormones, correct?
Yes, it does. Vitamin D does probably more things than we even know yet. In COVID, it was, it came out that it was a big part of your immunity, and those who are vitamin D deficient did not do as well if they got COVID than those who had adequate vitamin D levels.
I didn't know that. So what is vitamin D is in what? Like, what kind of fruit and vegetables?
Vitamin D it's like added to milk.
Okay.
But really your body makes it from the sun.
Yeah.
But if you have a lot of melanin, that's blocked. And then a lot of us are inside cats now,
Yeah.
TV and video games, so we don't even get that exposure. And then our diets, unless you're drinking milk or other fortified foods, but a lot of us are lactose intolerant. So it's really difficult for a lot of us.
It's not going to work? No, I'm kidding.
Those sunny days will work.
No, Sunny. You don't remember when
the drink. Man, my grandma used to have Sunny D. I didn't know Sunny D wasn't orange juice till I became double digits. I was like, Grandma, this is some food. This is sugar. This is just...
They don't even put vitamin D in it, do they?
It's orange. It's just orange. It's orange liquid.
It's orange
Sunny
Kool-Aid.
D, it was delicious, but it ain't orange juice.
Oh my gosh. And so you guys gave me Living My Best Life.
Yes.
Which is the optimal multivitamin mineral complex formula. Okay, sounds fancy. And then we have the Mother. Oh yeah.
Apple
I like
cider
this one.
vinegar.
Yeah, it's trying to help my hair grow. And then we got Queen Essentials.
Yes, which is our foundational multivitamin for women gummy.
Check them out, y'all. Check them out.
Yes. And up to 50% of the net profits go towards initiatives that focus on eradicating healthcare disparities. So we've given back to about 39 nonprofits so far to help their endeavors.
I love that. Dr. K, where can we find you online?
Everywhere now. So Instagram, TikTok, Facebook. Our website is Pro Black Health, PROBLK Health.com. And Pro Black Health is on Instagram and TikTok, and Karleena MD is my TikTok and Instagram.
Thank you so much for coming on the podcast. This is amazing.
Fun.
Make sure you guys tune in for part 2. We're going to be talking GLPs, okay? GLP-1s, right? That's the name.
One.
GLP-1. But yes, thank you guys so much for listening. Make sure to like, comment, subscribe, leave your questions for Dr. K at the bottom. Definitely check out Pro Black Health, and don't be afraid of bariatric surgery. All right,
Don't
you guys?
be afraid.
Don't be afraid.
If anything, go to a consultation and get your questions answered. You can always say no. Going to a consultation does not make you do anything. You don't have to have surgery. It's just to get more information, and then you can decide what to do with that.
I love it. Thank you guys so much for watching, and I'll see you on the next episode. Peace.